Hey everyone, welcome back to another episode of my Baby Step series. In this episode, I'm going to be talking about what IVF is and how it works. So IVF stands for In Vitro Fertilization, but a lot of people know it as a test tube baby. This is the medical process where they take the eggs from a woman and the sperm from a man, put them together in a lab to create an embryo. They then put that embryo back into the woman's uterus and see if it works. In a lot of cases, IVF can be one of the first things recommended by doctors, depending on what the patient's diagnosis is. But for many cases, like myself, if your doctor believes that you have some type of chance getting pregnant relatively naturally or with less intervention, then they will recommend certain things first. A lot of clinics have policies or recommendations to do treatments in groups of 3s. For example, the first step is often 3 medicated cycles with timed intercourse. So timed intercourse means that you're taking meds to stimulate the growth of your follicles. These are often very low dose medications. Ovulation is then medically triggered by an injection at the appropriate time based on follicle size, and then you are told which days to have intercourse at home. If those 3 medicated cycles don't work, then the next step would be to try IUI. IUI stands for Intrauterine insemination, or otherwise known as artificial insemination. And this is basically the same as timed intercourse, except that instead of having intercourse at home, you are coming into the clinic after your trigger shot to have a procedure done where you take a sperm sample, whether it be from your spouse or from a donor, and then they use a catheter to put that sample inside of the uterus. Setting up the initial consultation for IVF can sometimes be time-consuming and take a while. When we were first referred for IVF, it took about a month before we had our first initial consultation. Following that consultation, especially if you are now meeting with a new doctor like I was, you go over all of your previous tests that you've taken, what he thinks about it so far, you talk more about your options and your chances, and then you're often told to go get more blood tests done, more ultrasounds done, just to kind of cover all the bases before getting deep into the protocol part. And ideally, you want to try and get those blood tests and those ultrasounds done as soon as possible because again, scheduling that follow-up appointment can sometimes be a waiting game. There was yet another month between our initial consultation and our follow-up appointment. At that follow-up appointment, you go over the results of the tests that you just took over the past month, and then that's when your doctor discusses with you the protocol that he wants to move forward with in terms of IVF. So in Ontario, OHIP covers 1 IVF cycle per lifetime. But the caveat to this is there's often an extensive wait list. And this wait list can get kind of confusing because it's not the same at every clinic, not even the same for every doctor within that clinic, because every clinic gets a different amount of funding each year, and those clinics distribute it differently. And then sometimes certain doctors within those clinics are more popular than others, and therefore the wait list is longer. For example, I have heard some clinics in Toronto, such as Repromed or Create, have 0 waitlist, whereas my clinic at Trio, when I first was put on the waitlist back in December, I was told that the wait was about a year. However, if you choose to privately fund your cycle, aka pay out of pocket, then you can pretty much start immediately. So awesome, you're starting IVF, you've signed the paperwork, you've signed the consents, there's a lot of consents, you've met with your doctor, you know what meds you're going to be on. So what's next? The first thing you're going to wait for is day 1 of your period. And on day 1 of your period, you're going to call in or email your fertility clinic to let them know it's your day 1. They should call you back relatively soon because they're going to want you to come in for either day 2, 3, or 4 for your preliminary blood work and ultrasound. This is going to give them a baseline of what your cycle looks like in terms of your hormones and your follicles. You should get those results back same day, and they should be telling you whether you're good to go or whether there was an issue with your results. Sometimes prior to your initial baseline appointment, you'll do something called priming, which is a part of a lot of people's protocols. And essentially this means you're on a type of medication, whether it be birth control or some other type of hormone repressing medication, that will bring everything down to the same level. So everything's going to be starting from square one. This doesn't work for some people because sometimes people can get oversuppressed and then your follicles don't end up growing as much during the stim phase, but for other people it's very beneficial. So if you're good to go, then that's when you'll be given the in-depth instructions on when to start taking your stim meds. And stim is the word that we use for stimulatory medications, which are for IVF most often subcutaneous injections which go into your stomach. The timing, types of medication, and dosage of the medications are specific to each individual treatment plan. And how long you will be on them really depends on how well your body responds to the drugs and how quickly your follicles grow. For my IVF cycle, I think I was on Stims for about 5 days before my first monitoring appointment, and then from there I pretty much went in almost every other day up until it was time to trigger. Once the doctor decides that the follicles are a good size, then you'll be instructed to use a trigger shot to induce ovulation, and then your egg retrieval is typically scheduled exactly 36 hours after the time that you're told to do your trigger shot. And it's very, very important to take your trigger shot at the time that they tell you. And the reason for this is because if you take it too early, then by the time you get to your egg retrieval, it may already be too late and there might be nothing to retrieve. If you take it too late, the eggs might not have had enough time to detach from the follicular wall and they'll get stuck. So take it at the correct time. At my clinic, when I got there, they had me go in alone to get prepped and Peter waited in the waiting room. Getting prepped involved putting in an IV, having me dress in the gown and cap, giving me an Ativan, which was a tiny, tiny little pill that they said to dissolve under my tongue, and then they gave me some gravel through my IV. And these things were to relax me before the procedure. So prior to going into the procedure, Peter came in at some point after he had had a chance to provide his sample, and then we went into the procedure room together. The egg retrieval procedure really shouldn't take longer than 20 minutes. Mine was much less than that because I had so few eggs to retrieve. And afterwards, you're asked to kind of just sit and chill out for about 20 minutes after, just so they can monitor you before letting you go home. So I've read a lot of stories about how women have experienced their egg retrieval and how it was for them. For me in particular, I was conscious the entire time. I pretty much remember most of it and I felt zero pain. If anything, I was just like a little bit sleepy, but I was totally relaxed. That was something I was really nervous about. So I got lucky there, but I know that some women fall asleep or don't remember any of it at all. Or for some women, it's a really, really painful experience. So I don't want to scare anyone who might be going into IVF and watching this video, but just prepare yourself because everyone kind of experiences it differently, same as the recovery time. I have found that for those that it was a really terrible, painful experience were the ones that had a lot more eggs or their ovaries were hard to reach. Before you leave, you will be told how many eggs they retrieved, which is great. Expect some cramping over the following few days. I had cramping for probably almost 3 to 4 days after, even though I didn't feel any pain during the procedure itself. And I recommend taking it easy and maybe even taking a couple days off work if you can. The day of or the day after the retrieval, that's when you're going to be starting the intramuscular progesterone and oil injections. Progesterone and oil is most often used for IVF because it's easier to measure via the blood work. There is the option for progesterone suppositories. And some people are 100% on the PIO injections, some people are 100% on the suppositories, some it's a mix of both. So just discuss with your doctor what your options are. If you're really, really terrified of needles, which I will admit, the progesterone and oil shots, since they're intramuscular, the needles are pretty honkin' big, but I had quite a bit of anxiety myself about that particular injection. But it's really, like everyone says, not as bad as you think it will be. Promise. This is coming from someone who is terrified of needles, and looking at that thing makes me feel sick, but it really barely hurts. So day 1 after your egg retrieval, you're going to get a call telling you how many of the eggs successfully fertilized. And there are a couple of fertilization options during this process. One of the ways in which they do it is kind of the natural route, where they basically take the sperm sample, take the egg, put them both in a dish and let it do its magic, and whatever happens, happens. The other option, which is getting used more and more and more and is very common in cases where the couple has male factor sperm issues, is called ICSI. But that is essentially where they take a specific sperm, they pick that special guy, and then they inject it into the egg. Day 3 after egg retrieval, you will get another call telling you how many of the fertilized eggs made it to day 3, and these are called day 3 embryos. And then finally, day 5 and sometimes 6, if they're slow growers, you will get a call telling you how many made it to the blastocyst stage. And the blastocyst stage is basically when the cells have multiplied enough to reach the next stage of development. And most often, clinics prefer to transfer day 5 blasts. Day 3 transfers happen sometimes in special cases, and if you think that that's right for you, it's also something to bring up with your doctor. I really do encourage you to advocate for yourself, do your own research, and ask your doctor questions. It doesn't hurt to ask. I didn't get a call on day 5 because I had a fresh transfer. A fresh transfer is when they transfer it back into you right away. So I had already had that appointment scheduled, and we basically found out once we got there how many of my embryos made it to that stage. So you'll get a call if you're doing a frozen transfer later on, because the embryos that made it to day 5 are going to be put on ice essentially until such a time when you decide to transfer it. So after you do a transfer, whether it's fresh or frozen, about 10 days later, you go in for your blood test, which will tell you whether or not you're pregnant. And you should be told the same day as to whether it's positive or not. One thing to note is when you're trying naturally, typically you're advised to wait until 14 days past ovulation to take a home pregnancy test. So you're probably wondering, why is the blood test after IVF so early? 10 days seems like really soon. Can you really pick up a pregnancy that early? The answer is yes, and for these reasons, because you are transferring a 5-day-old embryo. It's basically equivalent to 15 days past ovulation. And secondly, blood tests can pick up much lower amounts of HCG, which is the pregnancy hormone. The most important thing to keep in mind before diving into IVF is to have realistic expectations. At your baseline, if they don't tell you automatically, you should ask what your AFC is, which is your antral follicle count. This will give you a really good idea of how many follicles to expect to be growing when you're on the stim medications during IVF. Because unfortunately, the worst part about IVF is that the numbers just get worse day after day after day. As a very broad example, let's say you have 10 follicles growing. Let's say you go into your egg retrieval and they retrieve 8 eggs. And then the next day you find out that only 5 have fertilized. And then by day 3, you find out only 3 have made it to day 3. That's a lot of 3s. And then let's say at the very end, you wake up on transfer day, you find out you have 1 5-day blast. So as you can see, the numbers can just kind of be disappointing each day. It's hard to not look at it as a negative thing each time. I was aiming for 1 blast to transfer. I felt like that was the most that I could hope for with my research, with my antral follicle count, with everything that I knew about this process. I was hoping for 1, and that's exactly what I got. And I also knew that first time IVF is often not successful, and it often takes several rounds of IVF to get that positive pregnancy test. I had my 1 good embryo, and that 1 good embryo didn't stick. And I was way more okay with it and handling it way better than I thought I would have, and I think that's entirely due to me having realistic expectations. I honestly didn't expect it to work, and it didn't, so it met my expectations, frankly. I've also read of cases of people getting something like 25 eggs, but then finding out the next day that none of them fertilized, and then that's where their IVF journey ended. Or some have a great outcome. They have tons of eggs, tons fertilized, tons made it to day 5, but then they get genetic testing done, and then they all come back up normal, and they have nothing to transfer. So yeah, there are so many different outcomes to this process, and it's really hard not to compare your outcome or your cycle to other people's, especially when the diagnoses and the treatments aren't the same. It's not super helpful to compare. So going back to the PGS testing, that's the genetic screening of the embryos. Oftentimes, frozen transfers are done the most often because people want to send them off for genetic screening to make sure there's no issues there. It is an added expense. I'm not sure exactly how much because it wasn't something that we looked into. Our doctor personally didn't recommend it for us simply because of our young age, and because of the low AMH, we didn't expect to get many embryos to begin with, and it didn't really make sense to me to spend like an extra $5,000 to get 1 embryo tested. So separate from genetic testing, your embryos will also be graded, and the grade will typically be made up of 1 number followed by 2 letters. For example, our 1 embryo was graded 4AA. So the number represents the degree of expansion, so basically how much has the embryo grown and multiplied. The first letter represents the inner cell mass quality, and the second letter represents the trophectoderm quality, not sure if I'm saying that right, which are essentially the cells that will be making up the placenta. I know that different clinics use different grading systems, so make sure to look at your specific clinic as to what they mean, because sometimes the lower the number the better, whereas in my clinic the higher the number the better. So the 4 represented a unhatched blastocyst, and at my clinic I think it went from A to C, but A was the best quality in that category. So I had a great looking embryo, and that being said, try not to put too much stock into the grading of the embryos because it's really more of a beauty contest. For example, my beautiful 4AA embryo failed, and I've seen countless stories of lower grade embryos resulting in successful pregnancies. So to sum up our cycle, my AFC was about 7 or 8 depending on the times that they checked. I expected about 7 eggs, and they retrieved exactly 7 eggs. Only 2 of them were mature. That's the other thing too. If they aren't mature, they likely won't fertilize. So only 2 of my eggs were mature. both of those eggs successfully fertilized. Both of them made it to day 3 and only one made it to day 5. So you're at the end of your IVF journey, you're in your 2-week wait, you're taking your progesterone shots, which if you are pregnant, you will continue taking until you're 10 to 12 weeks along. But let's say you found out that it failed. What do you do then? Well, first thing to do is to let yourself feel everything you need to feel. Take time to grieve and take time to deal with the loss and the emotions that you're going through. But the second thing you want to do is basically schedule your what the f appointment. And this is the appointment where you sit down with your doctor and you pretty much talk about what went wrong, what happened, and what do we do next. So that's it. That's pretty much everything about what IVF is, how it works, and the entire process from beginning to end. I'm hoping I didn't miss anything, or if other people's IVF experiences were different, please let me know. If you have any other questions, I'm happy to answer them for you. Thanks so much for tuning into the Baby Step series, and I hope you come back next time for more episodes. Bye!